Hello, I'm Christopher Springmann, and you're listening to NephTalk, a podcast series created with nephrologists in mind from Satellite Healthcare, a not-for-profit dialysis provider that leads the industry in home therapies while supporting clinical research. Our guest today, Dr. Richard Gibney, MD, has practiced nephrology for 40 years in Waco, Texas. Over a decade ago, he implemented a unique approach to engaging patients personally in their own dialysis procedure instead of, as he says, just hunkering down in a chair. This is the story of Dr. Gibney's journey to empowering patients through self-care dialysis, which he describes as a life-changing experience for everyone involved. First of all, Dr. Gibney, thank you so much for joining us today on NephTalk.
Thank you, because this is a treat for me to have the opportunity to talk about empowered dialysis and the great changes this is making in patient care.
Absolutely, and that's my first question. Let's discuss your history of implementing self-care or empowered dialysis, please, and what inspired you to invite the first patient to experience this in a center from Sweden to Waco, Texas. Tell me about that experience and what inspired the invitation.
We had practiced nephrology in a very traditional way and medicine in a very traditional way until 12 years ago. And a dear friend of mine said, you need to come to this meeting that I go to every year that's just phenomenal. And it's called the Institute of Healthcare Improvement, IHI.
Yes.
And Don Berwick started this about 25 years ago, and at that time there were about 5 people that would come to the meeting, and now there are 7,000 people that come from all over the world.
Yes.
And the whole concept is medicine should be involved in continuous quality improvement, but medicine back then was not real interested in continuous quality improvement, but Don Berwick was. And so gradually, he began teaching the science of quality improvement. By chance, I met Don Berwick in the hallway, and he became our mentor and taught us the science of quality improvement, of how to continuously improve the quality of the medical care we provided. And then from that, we went on to patient-centered care, and all of this dramatically improving the quality of care that we provided.
You have said, Dr. Gibney, that for years you performed dialysis in the old-fashioned way, which you called the hunker-down approach, that patients received instructions to sit down, remain still and quiet, and not to touch anything as the staff attended to details. How does that compare with the empowered patient approach to dialysis?
Yeah, it's really a radical change in that we say to them, welcome. We're delighted to be able to provide service that will help you regain your health. We want to guarantee that you're going to contain your control. And part of that process is we're going to teach you, train you, coach you on how to build your own machine. You'll know everything that goes on with this.
Well, this is such a contrast to, if I can use the term, bad old days, that while you were trying to be helpful to patients, you essentially were teaching patients to be helpless. You discovered, as you've just suggested, that people like to be involved in their treatment. It gives them a mental and spiritual and, frankly, joyful boost. Would you agree with that?
Absolutely. We thought people would do better when we started. They just didn't do better. They did dramatically better. The national average for mortality is 16%, and we've dropped the mortality rate to 5%. The hospitalization rate nationally is 1.7 hospitalizations per patient per year, and we dropped that to 0.8, less than half. And so the numbers were just staggering. Over 60% of our patients are on empowered dialysis, and those numbers have held very steady. So you'll live longer and a dramatic improvement in health and lifestyle. The staff very quickly said they had great concerns because it was so successful. We were going to fire them, because we wouldn't need them. We wouldn't need them anymore.
Sure.
And I reassured him and said, no, it's the opposite. You're going from being a worker bee running around doing everything to being a coach, a trainer, a mentor, a teacher. And this is a powerful, wonderful process. So that was very reassuring.
I'm very glad you mentioned that, because I'm very concerned, and I'm sure our listeners are too, about how you maintain quality standards with oversight while patients were doing the procedure. I'm very interested in issues around infection and disease. Can you elaborate on that?
Yeah, the answer, of course, is that the quality dramatically improves because you have this large army of patients that are now intimately involved in their care and want the very best care possible for themselves. And so quality numbers were already very good when we began this process because of our work with Don Berwick and IHI. But having the patients, it just sort of guaranteed high quality. Some people would raise the question, well, what about the liability of allowing patients to be involved in their care?
What about the liability, doctor?
And we said it's the opposite. It should be, what about the tremendous benefit? You can imagine the patients now know exactly what should be done. It makes it a nice blessing because the staff, if they happen to make an error putting out disposables or drawing up medications, the patient notices it immediately. And so the patients, it's the opposite. The patients make it a much safer treatment because they know exactly what's going on. They know exactly what to expect. And it wouldn't surprise you that self-cannulation, the patients do it much better than our dialysis staff because it's their arm. They know how to feel their vessel. And so basically, people doing the self-cannulation, it always goes smoothly and well. They never have a problem.
Have you ever considered, Dr. Gibney, hiring dialysis patients as certified technicians?
We have, and we're looking at that now to see exactly how we could do it. The wonderful thing about this whole process is what used to be the separation between staff and patient was severe. Patient did nothing, laid in the chair, helpless and depressed, and the staff did everything. Now it's a team where it's a partnership where everybody works together. And this is one of the wonderful things, the spontaneous things that occur. So when we get new staff and they're out on the floor training and learning how to build machines, frequently they'll have some trouble. And one of the senior patients will come up and say, I see you're having trouble stringing the line. Let me show you how to do it correctly.
Satellite Healthcare is the market leader in home dialysis, I believe, with 20% of patients participating in home dialysis. What can be done to move more people to that position of doing dialysis at home? Can staff and patient techs, dietitians, and of course nephrologists do that successfully based on your model?
Absolutely. I think that Satellite's done a fabulous job at being the leader in how to do a high percentage of people on home therapy. And the reason being is that when we see people in our outpatient clinic and they're progressively losing function, we give them the option of transplant preemptive if possible. And if not, then home therapy is our first choice. Second choice would be nocturnal therapy at night on 8 hours at night, very slow and gentle, great results. And then the third choice, empowered in-center, which is basically like home therapy in-center, where the patient does everything, but they just happen to be in-center.
What is your goal, doctor, in terms of patients either being trained initially to do dialysis at home or migrating from the center experience to home dialysis? Do you have a target in mind?
Absolutely. And again, I have to give a lot of credit. IHI has been sort of our guide through this whole story because they're so clever and so innovative. And so I was at an IHI meeting, and all these meetings are global now because people have the same medical problems, but different way of focusing it, different framing, different financials. So anyway, I was meeting with a group from Australia. So I told them I was a kidney doctor, and I said, well, how do you do it in Australia? And they said, well, 40% of our patients are on home therapy. I said, really? I said, wow, that's really tremendously successful result. And I said, how do you do that?
Now, to qualify that 40% number, doctor, are these patients who essentially went from diagnosis to home therapy and bypassed the center experience, except perhaps for training?
Absolutely. So, of course, my response was, how do you do that? And they said, well, we start everybody on home training. They said, well, that's easy. If they can't do home, then they just transition into in-center easily. It's not a big deal. But why not start with the best form of therapy first?
As I mentioned earlier, Dr. Gibney, you once said, we were trying to be helpful with patients, but we taught them to be helpless, taking away the feelings of anxiousness and fear that something is happening to them versus taking charge of their own dialysis might just be part of your legacy, doctor.
Well, I think for sure it's the part of the legacy for the patients and the staff. Yeah, there's no question that the humanity of what we should be focusing on now is relationships and trust, and that relationships are powerful. If you want to give the patient an opportunity to be successful, you have to have that relationship and trust. In addition to that, you have to have a focus on customer service, because great customer service means that the patient's going to be much more receptive to the ideas that you bring about.
You really enjoy this, don't you? You just exude a passion and a love for your work, and also for this incredible change in how dialysis is not only done, but perceived by patients and nephrologists. It's amazing.
You know, if what you do is joyful and happy and the patients love it, and it's the way that everybody started in medicine, to be helpful and to touch hearts and souls and to help people be well, and this gives us that avenue to do exactly what we always dreamed about.
I love your dreams, Doctor. Dr. Gibney, thank you so much for joining us today on NephTalk.
God bless. Thanks very much.
Dr. Richard L. Gibney, MD, is the president and partner of Central Texas Nephrology Associates, headquartered in Waco, Texas, with 10 nephrologists in the group practice, 11 dialysis units, and approximately 780 patients.